My practice is focused on patients who have had weight loss. Typically, my patients have lost at least 100 pounds or more. Most of my patients have had gastric bypass or a significant dieting exercise to have lost 100, sometimes even over 600 to 700 pounds. Just depends on the type of patient. And my patients, because of their massive weight loss, develop a lot of excess skin and some residual fat left over from that massive weight loss. So typically they need touch-ups in those areas.
And what percentage of your practice would you say is dedicated to post-bariatric patients?
My practice is dedicated to weight loss patients, and approximately 99% of my patients have lost at least 100 pounds or more. I have had 2 patients who used to weigh over 1,000 pounds, so anything under 1,000 pounds I've seen in my practice.
And does your office accept any medical insurance?
We do a significant amount of insurance work. Approximately 80% of our seeking for insurance approval gets approved. I go out of my way within the office to take pictures, provide medical documentation, talk to other doctors, including dermatologists, internists, chiropractors, neurosurgeons, to get insurance approval. And the letter that I send out is about 14 to 15 pages to seek insurance approval. So I believe that most of these procedures should be covered by insurance. It just takes extra effort on our office part to get it approved by the insurance.
When would you recommend for a post-bariatric patient to start looking into plastic surgery?
Very good question. There are 2 types of weight loss patients. There are the patients who have a traditional, if you will, Roux-en-Y gastric bypass, and there are patients who have a lap band. The patient that has a Roux-en-Y gastric bypass will typically lose their weight between about 8 to 10 months out from their Roux-en-Y procedure. Then I like their weight to be stable for about 2 or 3 months, being a constant weight where the weight doesn't fluctuate, and then they can think about plastic surgery. The lap band patients, they lose their weight over a gradual period of time, typically about 20 to 22 months out, and then I like their weight to plateau for about 3 to 4 months before they think about plastic surgery. So if one is about to have a Roux-en-Y surgery, you can start thinking about plastic surgery about a year out from your procedure. With lap band, it's about 2 years out from your initial lap band. But those are just generalizations. The take-home message, though, is after your gastric procedure, you need to have a constant weight of about 3 months' time before you even think about plastic surgery.
And what kind of services do you offer in the office? What are the typical procedures you do for post-bariatric patients?
Typical procedures that we see after massive weight loss are tummy tucks. If you have a lot of excess skin and fat in the hip region and even in the buttock region and the buttock sags, I turn that tummy tuck into what I call a power lift, which goes all the way 360 degrees around the body, resulting in what we call a circumferential, that means all the way around the edge, body lift. I also do a significant amount of leg lifts, which are basically incisions in the leg to lift the inner thigh up. Other procedures that I do would be breast lifts, breast reductions, and sometimes breast augmentations and lifts in females, and in the males typically we do breast reductions. The other procedure that we do a lot are arm lifts, getting excess skin and the fat in the arms off, and we also do a significant amount of face lifts and neck lifts to get rid of excess skin and fat in the neck.
Dr. Katzen, how long have you been doing this, specializing in post-bariatric patients?
Sure. I've specialized in plastic surgery after weight loss for the past 8 years. I've honed down a lot of skills that are very unique in my practice, and we have come up with a very traditional way that works very well, which is safe to do, and I stage these procedures to get you the best possible outcome.